Let's study circulatory system part 2. So in that we are going to study about blood vessels, blood components, then functions of the blood, blood group, blood coagulation and a few more things. So blood vessels, there are a few different kinds of blood vessels. So first is artery. So this is the artery which carry, so it is a blood vessel which carry blood from the heart. So it is away from the heart. So it is thick walled artery because it carry blood under the increased pressure. Then branches of artery is called as arteriole. Then smallest branches of the blood vessels is called as capillaries. Then capillaries join and form venules, and venule join and form the vein. So important great vessel is vena cava, which is formed by combination of the superior vena cava and inferior vena cava. Now we will see difference between artery and vein. So artery is the blood vessel which carry blood away from heart. Vein is the blood vessel which carry blood towards the heart. So artery carries oxygenated blood except pulmonary artery. Vein carries deoxygenated blood except pulmonary vein. Arteries are deep in location, veins are superficial. Artery wall is thick because it carries blood under increased pressure, and vein wall is thin because it carries blood under normal pressure. So arterial blood collection is used for the blood gas analysis, and mainly radial artery is used, and veins are superficial, so easily we can do collection for all biochemical and serological testing. Now we will see blood. So it is connective tissue, liquid connective tissue, which consists of the cells like RBC, WBC, platelets and plasma, and it is red in color. pH is slightly alkaline, that is 7.2. Blood volume around 5 liters of the blood is present in body, and viscosity is 5 times more than the water. Functions, main function is nutritive. It supplies glucose, amino acids, vitamins to the all body parts. Excretory, it excretes unwanted substances from the blood, that is urea, uric acid, creatinine from the kidney. Respiratory, blood carries oxygen from lungs to tissue and carbon dioxide from tissues to lung by the hemoglobin transport. Then acid base balance, regulation of body temperature, viscosity, water balance, clotting of blood because of the platelets, maintenance of the colloid pressure, hormone transport, then defense mechanism by the WBCs. These are all the functions of the blood. Now we will see blood cells, that is RBC, WBC and platelets in detail. So RBCs, red blood corpuscles, also called as erythrocytes. They are anucleated cells by concave. Size is around 7.2 micron. It contains hemoglobin, and so it is also called as red pigment. The lifespan of RBCs is 120 days, and function, it contains hemoglobin which carries oxygen from lungs to tissues and carbon dioxide from tissues to lungs. WBC, they are leukocytes, white blood cells, and they are nucleated corpuscles. So they are divided into two types according to the granules. So granulocytes and agranulocytes, that means granules absent. So granulocytes are of three types: neutrophils, pink color granules; eosinophil, orange color granules; basophil, they are dark blue or black color granules. Agranulocytes, monocyte and lymphocyte. Lymphocytes again small and large lymphocyte. So platelets, they are small non-nucleated bodies around 2 to 3 micron present in the smear. Consist of the cytoplasm. The normal lifespan of platelets is around 2 to 3 days. Function, to help in hemostasis, that is prevention of blood loss by platelet aggregation or the release of vasoactive substances and cause vasospasm, so stoppage of the bleeding. Now we will see blood group system. So there are two types, ABO and RH. So these antigens are present on surface of the RBC, and by that we can see the blood groups. And natural antibodies, they are IgM type, they are present in plasma. So total 4 types of ABO's blood groups are there, that is A, B, AB and O. So A contains A antigen and anti-B antibody in the serum. B group contains B antigen and anti-A antibody in the serum. AB contains antigen A and B both and no antibody. Blood group O contains no antigen nor A or B, and anti-A and anti-B both antibodies are present in the serum. Blood group system is developed by the Karl Landsteiner, And the second system is RH system. So these antigens first discovered on red blood cells of the rhesus monkey, and then they are found in the red cells of the human. So these antigens are called as rhesus antigen or RH antigen. So if RH antigen is present, it is called RH positive, that means D antigen present, and in RH negative, so D antigen absent, it is the RH negative person. Now we will see blood coagulation. So it is the mechanism of the hemostasis. So hem means blood and stasis means stop, to stop bleeding. Clot is composed of network of fibrin threads and all the blood cells like RBC, WBC and platelets. So it prevents the blood loss. The few steps in coagulation. So after the blood vessel injury, the thromboplastin is released, which converts prothrombin into thrombin, then thrombin converts fibrinogen into fibrin, and then finally many fibrin and all the blood cells come together and it form the clot. There are few coagulation factors present in blood, but when blood flows they are inactive, but when injury takes place they become active. So factor 1 is fibrinogen, 2 is prothrombin, 3 is tissue thromboplastin, 4 is calcium, 5 is labile factor, 6 is not recognized, 7 is stable factor, 8 is anti-hemophilic factor, 9 is Christmas factor, 10 Stewart power factor, 11 plasma thromboplastin antecedent PTA, then 12 Hegman factor, and 13 fibrin stabilizing factor. So the factor 8 and 9, they are related to the hemophilia A and B. So lymph is the fluid which circulates throughout the lymphatic system, and the lymphatic system is made up of lymph nodes and lymph capillaries. So lymph mainly composed of the blood plasma, like, but slightly differ. So it contains white blood cells, and mostly in the lymph node it is richer in lymphocytes. And in digestive system it is called as chyle, which is rich in the triglyceride, so the appearance is milky because of the lipid. Let's study about the echocardiography, that is ECG. So it is the process of recording of electrical activity of the heart over a period of time using electrodes placed on the skin. So these electrodes detect tiny electrical changes on the skin that arise from the heart muscles. Electrophysiological pattern of depolarizing and repolarizing during each heartbeat. It is very commonly performed cardiology test. So the machine is called as electrocardiograph, is used to obtain the electrocardiogram. So ECG is a graphical representation of the electrical activity of the heart during the cardiac cycle. Procedure of the ECG. So 10 electrodes are placed on the patient's limbs and the surface of the chest. The overall magnitude of heart's electrical potential is then measured from 12 different angles and is recorded over a period of time, usually 10 seconds. In this way, the overall magnitude and direction of the heart's electrical depolarization is captured at each moment throughout the cardiac cycle. The graph of voltage versus time produced by this non-invasive medical procedure is referred as the electrocardiogram. So now in standard ECG there are few waves, so that is P wave, QRS complex and T wave. So P wave represents the electrical excitation, that is depolarization of the atria, which leads to contraction of the both atria. The QRS complex represents depolarization of the ventricles, which initiates the ventricular contraction. The contraction starts shortly after Q wave and marks the beginning of the systole. The T wave represents the return of the ventricle from excited to normal state, that is called as repolarization. The end of the T wave marks the end of the systole. By counting the number of QRS complexes that occur in a given time period, one can determine the heartbeat rate of the individual. ECG of the great clinical significance, because from different individuals roughly there is a same type of shape, but if any deviation in the shape takes place indicates the abnormality or the disease of the heart. So ECG conveys the large amount of information about the structure of the heart and function of the heart. So ECG can be used to measure the rate and rhythm of the heartbeats, size and position of the heart chambers, presence of any damage to the heart's muscle cells or conduction system, the effect of the cardiac drugs, and the function of the implanted pacemakers. So it is of great clinical significance. Now we will see disorders of the circulatory system. So it is because of the lifestyle diseases that depends on the person's habits, diet, smoking, or any other history of the addiction. So first is the coronary artery disease. It is referred as the atherosclerosis. So atherosclerosis means it is thickening of the artery. So it is because of the deposition of calcium, fat, cholesterol, fibrous tissue. So because of that, the lumen of the artery is narrow, and then there is deficiency of the oxygen to the heart tissues. So it is a risk factor for the acute coronary syndrome. So the second is the high blood pressure, hypertension. So normal blood pressure is 120/80, and if the individual's pressure is more than 140/90, then it is called hypertension. And high blood pressure leads to heart disease and also affects the vital organs like brain and kidney. So angina is also called as angina pectoris. So it is a chest pain because of the not enough oxygen is reaching to the heart muscle. Next is the heart failure. So it means the state of heart when it is not pumping blood effectively enough to meet the needs of the body. It is sometimes called as congestive heart failure because of the congestion of the lungs is one of the main symptoms of the disease. So it is not a cardiac arrest when the heart stops beating, or heart attack when the heart muscle is suddenly damaged by inadequate blood supply. Cardiomegaly, it is also called as enlarged heart because of the various causes like high blood pressure or coronary artery disease. Then arrhythmia is irregular heart rhythm. Then atrial fibrillation, so it is irregular heartbeat because of the pumping function of the heart is failed. Then heart valve disease, so mitral valve or the tricuspid, bicuspid valve are damaged because of some infection. It is called as the valve disease. Then sudden cardiac death, it is because of the half of the heart disease is the death. Then congenital heart disease, so diseases the individual is born with. So the main most common congenital heart disease is VSD, that is ventricular septal defect. Sometimes maybe ASD, that is atrial septal defect. Then heart muscle disease is called as cardiomyopathy. So it is smooth muscle disease. Hope you find this session useful for your understanding and for your exams. Thank you.